Welcome to Bonus Week Wednesday. Today we're going to talk some more about test taking strategies, and we're also going to do a bunch of different review questions just to give you a chance to kind of think about what types of questions that you'll be seeing. Yesterday we talked a whole lot about the different types of questions that were on the NCLEX. If you didn't get a chance to check that out, you want to do so. So this week, continue your question review plan. One thing that you want to be doing is when you do any of the questions, you want to take some time and review the answers and to find out exactly how that you're missing what you're missing, because that information can help you when you take the test, when you realize, and to study for the test, when you realize what types of questions make you stumble, then you can work on them. We talked some about this, multiple choice. Again, you have fill in the blank. That's usually a drug calculation or a math problem. You have multiple response, select all that apply. One note, when it's a select all that apply question, it will be marked, and it won't let, the normal questions won't let you select more than one answer. You also have the drag and drop, like order, what are the sequence of events, that's important. You might have a figure or illustration or a hotspot. And again, Saunders Online has a great, their online test bank that you get with your book. If you have questions about how to get into that, let me know, and we'll do a video that's dedicated to that. But they have an awesome question bank. And in that question bank, you can actually say, okay, I want to do just drag and drop questions. I want to do just select all that apply questions. I want to do just math problems, etc. Okay, this could be a question like you have asking about the intake and output. Don't be freaked out by it. Just take your time. Remember what you know, and then write in the answer. Again, this would be a good fill in the blank question. Signs and symptoms of post-thyroidectomy respiratory obstruction vary with the degree of severity. Which early signs and symptoms would the nurse expect with pending respiratory distress? Select all that apply. So, you think about it. First, you need to know, of course, what the post-thyroidectomy respiratory obstruction is. And probably the key word in this is early. What's the early signs and symptoms? Early signs and symptoms of what? Pending respiratory distress. Okay. And of course, the answer, difficulty swallowing, choking, and sensation. So 3 and 5 would have been correct. Stridor is late. Cyanosis is late. And almost everyone after the surgery are hoarse. Okay. This is like an ordered question. The nurse is preparing a staff education program about the stages of childhood development. Place the stages listed below in ascending chronological order. Use all the options. So the big thing here is ascending, right? If you don't know what that word means, then you're not going to get the question right. And then what you would do is, like we saw over there, you would drag and drop your responses over here. And again, when they're in the ordered response category, you can still move them around. Okay. The nurse, this is not a very good picture, but the nurse is performing a cardiac assessment on the client, and identify the area where the nurse should place the stethoscope to best auscultate the mitral valve. So you would need to know where the mitral valve, of course, is, and where best to hear it, and then you would click wherever the correct answer was. Again, ordered response, same difference. You enter your patient's room and discover a fire. Place your actions in the appropriate order. What you do first, second, third, fourth, fifth. Okay? Pretty simple. Again, these links we've already talked about. They're in the module page for this video. You can check them out there. Critical thinking, creativity, problem solving, decision making. Never one right answer that is always correct in every situation. You want to select the safest nursing judgment among the listed options. That's the one big thing. Safety. Safety. What is best, safest for your patient. You know, we talked about this yesterday. Identify the topic. Eliminate choices. Don't use the background information unless it's absolutely necessary. Don't read into the question. And remember, this is textbook nursing. Don't think about situations that you've had if you worked in the hospital or whatever. This is textbook nursing. Once the choice is eliminated, don't go back. Look for options that include the same idea and eliminate. Answer that is different is correct. So this is a good idea, this is a good example. So you have a monoamine oxidase inhibitor that's prescribed for the patient. The nurse instructs the client that which of the following, so we just answer one, is a sign and symptom of toxicity related to the use of medication. So let's say, for instance, that we have no clue what in the world a monoamine oxidase inhibitor is. We don't know. So let's look at the answers. You have restlessness, the feeling of fatigue, lack of energy, and lethargy. Well, if you think those three, feeling of fatigue, lack of energy, and lethargy, all are basically the same thing. You're drowsy, run down. The only one that is different is restlessness. And so if I were guessing, I would say the answer to that question would be restlessness. Why? Because it asks for one, and these three are all very similar to each other. And of course it is restlessness. But be aware, it's much better to know what a monoamine oxidase inhibitor is than it would be to eliminate the answers like that, because, you know, all the questions won't have three that are exactly the same. Find the question. What is it really asking? Only use the background information if it's needed. Use the keywords. We talked extensively about that yesterday. Best, first initial, most likely, least likely. So a client with cardiac disease turns on his call light and tells the nurse he is experiencing chest pain. What is the first nursing action? First. Not the second, not the fifth. What's the first thing you do? What's the first thing you do? Start oxygen. Don't read into the question. Okay? A lot of times, and it's easy to do, you read the question and then you want to think about some other things. Don't. Just pretend like that's the only patient you've ever had and go from there. If you ask yourself what if, you're reading into the question. Read the stem carefully before you read the answer choices. Try to determine what the question is asking before you read the answer choices. If you can't figure out what the question is asking, then look for some alternatives, for clues. Okay? So, a woman during the transition phase of labor complains of lightheadedness and a tingling sensation in her fingers. Which of the following action should the nurse take next? Okay? The easiest thing to do is not even read the answers yet. Make sure we understand the question first. So you have a woman, she's in labor, she's in the transition phase, and she is complaining that she has lightheadedness and tingling. So that are the signs and symptoms that she's had. She's in the transition phase of labor. So what should we do? So what was going on with this patient? She was in labor, but the signs and symptoms were of hyperventilation, right? So what do you do when someone hyperventilates, right? So you would do number one, have the woman breathe into a paper bag held tightly against her mouth and nose, right? So being pregnant in this case really had no bearing on what was happening with her signs and symptoms. Textbook nursing, one patient. Do not rely on experiences. We just said that. Pick the most right of the choices given. We've talked some too about the test, and it talks on the NCLEX test site about guessing. So let's say that you're coming to the end of your time at the NCLEX testing. You've already answered your 75 questions. Let's say you're on 120, just say, and you have 5 or 10 minutes left. So should you just answer as many questions as you want? Guess at all of them? No, you should not do that. You should just, as long as you're over the 75, you should take your time and answer each question. Why? Because what the NCLEX does is it takes the last 60, I think. Don't quote me on that. I review the thing to be sure. But it takes the last X number of questions. And how you did on those last X number of questions is how well you did. Are the answers a mix of assessments and interventions? If so, do you have adequate assessment information to intervene? If all are appropriate interventions, use Maslow to select which is the most important or appropriate to do first. Maslow's hierarchy of needs, know it. Note that if the situation described is an emergency, then an intervention will most likely be the correct response. If you have a patient that's not breathing or whatever, then it's going to be an intervention. Pain. It's a psychosocial need. Usually we'll address after the physical needs are met. The answer might be pain if there was a sudden increase or the pain is not controlled by a pain med. The nurse prioritizes her morning schedule to assess which of the following clients first. A young adult with complaints of severe back pain, an adult admitted to the unit with acute pancreatitis, complaining of unrelenting abdominal pain, an older client who complains of foot and ankle pain, a newly admitted client who complains of jaw pain and indigestion. So which would you choose? 4. The newly admitted client who complains of jaw pain and indigestion. Psychosocial versus physical. In general, eliminate the psychosocial choices, then prioritize the physical alternatives. Use ABCs, airway, breathing, circulation. Watch out for tricks. Oxygen, respiratory, communication. Avoid choices with I. Many times there will be more than one right answer. Watch out for which action should the nurse take first. Which of the following is an early sign of? A patient is admitted with a diagnosis of a ruptured abdominal aortic aneurysm. Preoperatively, which goal is most important for the nurse to include in the plan of care? Most. So, out of those, what is the most important? Fluid replacement, is it physical or psychosocial? It's, if you said physical, you're correct. Pain relief, physical or psychosocial. Emotional, physical, psychosocial. Aerosol, physical or psychosocial. Absolute words: all, always, every, must, none, never, only. Keywords that you need to be aware of. Delegation: what tasks must be performed by an RN? Teaching must be performed by an RN. Assessment: most invasive interventions. What tasks are delegated to nurse aide, etc. Routine, unchanging task. And what can an LPN, LVN do? Some things to not forget. Do not take antacids with meds. Do not crush enteric-coated and sustained-release meds. The patient should never suddenly stop a med. The nurse never adjust a med dose. The patient should avoid over-the-counter meds unless approved by the MD. Avoid alcohol and smoking. Never administer the med if the order is unclear. Many patients have digestive problems that are associated with milk. Basic care and comfort. The nurse sees smoke coming from the nurse's lounge. Sequence her actions below in the order in which they should be performed. So you see them there. So what should you do first, second, third, and fourth? We'll be asking a lot of questions. If you want, you can pause the video. So move the patients who are in the rooms closest to the lounge to the other end of the hallway. Patient safety first. Ask the ward secretary to call a code red. Patient safety. 1. Close the door to the nurse's lounge. Then try to take care of the fire. Which of the following would require a nursing intervention? Give me a moment. You can pause the video. Which of the following would require a nurse intervention? I should say select all that apply. 1, 3, 4, and 5. And then here you see why you do each of those. Physical restraints are being used to keep a client from climbing out of bed. Which of the following are true statements related to restraints? So, true. Which are true? Which of the following statements, so select more than one, which of them are true? Restraints can be ordered PRN. You should know. Nope. The MD order for restraint stands for the remainder of the time the patient is in the hospital. That's not true. Your skin integrity and neurovascular checks should be performed every 30 minutes. That is true. Restraint should be removed every 4 hours. That's not true. It's every 2 hours. Which of the following clients would be placed on airborne precautions? So, airborne precautions. Most important part of that question. So which one is it? It's the one with chickenpox. Airborne precautions. Which of the following describes the proper way to maintain droplet precautions during client transport? So, droplet precautions when you're moving a patient around. Okay, you look at them, think about it. Let's drill down a little. So, a client on droplet precautions would never be allowed to leave his room. That's not right. The nurse transporting, the client should wear a gown, glove, and mask. The client is covered with a sheet. Okay, a sheet does nothing for droplets, and you wearing something doesn't protect anybody that you pass from your client, right? The client is required to wear a non-rebreathing mask. That would be kind of going a little overboard. The client should wear a mask during transport. So I would say that the answer is 4. That is correct. Which client described below would be at the highest risk of developing anthrax? I'll let you read those. It would be a postal worker with impetigo opens an envelope with the bacillus and anthracis toxin inside. Here's a drug question. Again, a math question, if you will. We have a whole section related to math. You can check that section out for more information. But here is basically how you do it, and there's the answer. 500 milligrams of drug A has been ordered. This medication is supplied as unscored 1-gram tablets. Which of the following actions is indicated? Would you administer 1 tablet? Would you hold the medication? Would you administer half a tablet? Would you contact the MD? If you answered contact the MD, you're right. Why? Because if it's not scored, how can you be sure it's half? If you administer 1 tablet, you just give them a gram. If you hold your medication, well, that's not good. That doesn't. So, which of those answers makes the client more safe? Contacting the MD would do it. Which of the following is true? Now, these questions are kind of hard, but now what we realize is that all of these are false except for 1. So that means you need to know information about administering drugs, So the correct true statement is this. Why? Because this one is wrong. Only 1 milliliter can go on the SQ site. This one is wrong because the TB syringe only holds 1 milliliter. And insulin may be administered using any syringe. That's not correct. You can only use an insulin syringe. Again, another math problem. A nurse in the emergency room discovers an adult unconscious patient on the floor in the waiting area. What action should she take first? An adult unconscious patient on the floor. So, what should you do? If you said, shake the client and shout, "Are you okay?" you're correct. Which of the following is not one of the ABCDs of basic life support? Okay. A, airway. B, breathing. C, circulation. D, defibrillator, right? Yeah. You should really, especially these, know them. Read the book. So, it's not document. What is the appropriate compression vent ratio for 1 person CPR? 30 compressions to 2 ventilations. What is the proper way to check a pulse for a victim who is 4 years old? So, 4 years old, it's a PEDS patient. You said carotid artery, and you are correct. Why? If they're less than 1, you use the brachial. So this patient is 4, so you use the carotid. The AED, or the automatic defibrillator, shouldn't be used on which patient? Okay, if you said this one, then you would be correct. It's not recommended on a child less than 8 or who weighs less than 25 kilograms. Again, we could go through, in fact, one day I think what we'll do is go through the rest of these questions. But for today, I think that's enough. That gives you an idea. The main thing is to, read the best way to pass the NCLEX is to answer questions, period. The more questions you answer, the better you get at it. But you need to be careful, because sometimes questions that you answer aren't quote-unquote good questions. Again, like I said before, the Saunders book, we looked at a ton of books in online places. Those have about the best questions for the money. Okay, so 50 bucks you get, 50 bucks you get, about 5,000 questions. So anyway, speaking of questions, if you have questions, please do not hesitate to give us a call, or not give us a call, send us an email or leave us a comment. And the answer to this question is the nurse is responsible for ensuring that informed consent has been obtained by the MD prior to the surgical procedure.